Hi, my name is Randy Willett, and I'm sitting here with Moshe Roshjal, who's a licensed professional counselor in Denver, Colorado, and also a certified sex therapist. And I'm here to interview him about his practice when he deals with sex therapy and want to find out what he actually does. So I'd like to first ask you, what are the common issues that someone will come seek out a sex therapist for?
Well, most clients come to sex therapy for a number of really important issues around sexual function and expression. It could be performance anxiety for men, low libido. It could be sexual addictions of all sorts. And it could also be limited sexuality because of abuse history of some sort. People also come to therapy around all kinds of sexuality issues, sexual orientation, potentially transgender issues, and anything that has to do with sexual function and expression.
What do you consider the barriers to be to healthy sexuality?
Well, there are lots of barriers to healthy sexuality, mostly because we all come from a culture that basically gives us very negative messages about sex and sexuality. So most of us have learned in some way or another that sex is something, not only on one hand not to be discussed, but potentially even something that might be dirty or something that might be sinful. And so that certainly does have and creates limitations on healthy sexuality.
I would think that one of the most difficult issues a man would call you about would be erectile dysfunction. And it would be hard for him to even talk about, or a lot of shame around that. I'm wondering, how would you deal with that?
Well, I do get lots of calls about sexual dysfunction. A lot of men get really frustrated because they do feel afraid or shamed about being able to talk about it. For most men, if it's not something that is physiological or biological in nature as a result of some sort of disease or medication, then it often is a psychological and emotional issue. And what we would do in therapy is basically go through a treatment plan to rule out, first of all, any kind of physiological issue, and then go through a process of understanding what the basis of the performance anxiety is, and or the sexual dysfunction, and go from there.
I would imagine that you'll get just this question like, how can you help me get an erection again? What do you say to someone?
Well, I say that we have really good ways of dealing with the emotional and psychological issues around erectile dysfunction. Not only are there many tools that I offer my clients to help them deal with this issue, but also ways of looking at the kind of messages that they've bought into around the anxiety and stress of sex that might help them be able to better handle their sexual expression.
Well, I really appreciate your time today, Moshe, and look forward to maybe interviewing you soon again in the future and doing another video with you.
Great, I appreciate it.